Get started. I will close the door in a few minutes. So I'll let a few latecomers come through, but maybe only 2 missing anyway. But my name's Kelsey. This is Dr. Beth. We're going to do a little bit of a presentation today on metabolic health. Hopefully the few online can hear me, but just so you guys are aware, there is a Q&A area on your screen, so you can pop in any questions at any time and then we'll answer them at the end. And for everyone else as well, we'll answer all questions at the end. So jot down notes or anything like that if you have any missing information or bits you want to know, and we'll go from there. Yep. All right, do you want to start?
Good. Yeah, no, very happy to start. So thank you all so much for coming out tonight to talk about one of my favourite topics, which is metabolic health. But to start off with, I just want to acknowledge the traditional owners of the land in which we're meeting today, so the Dja Dja Wurrung people, and pay respect to elders past, present and emerging, and extend, this welcome to any Aboriginal or Torres Strait Islanders that might be with us this evening. Oh, it's shining on it. Oh, it's like we're in the movies now. So just a bit about me to start off with, if that's okay. So I'm Beth, I'm a GP, and this is my family. So my husband, Matt, and then I've got a 4-year-old and a 2-year-old, Maeve and Sophie, so they're my little girls. But yeah, I was doing regular general practice, but realised that, I felt like in a 15-minute consult, I couldn't really get to the bottom of what people were really coming in for, and felt like we were really streamlined into, here, have this prescription to fix your issue, but I didn't really feel like I was fixing anything. So really wanted to find out more about what people could be doing in their own lives to both manage and prevent the development of different chronic diseases. And that's when I found out about lifestyle medicine, because I also really wanted to make sure I was still practicing evidence-based medicine, because that's sometimes the area gets a bit grey and it's like, actually, where does the evidence lie? But I've then gone on to complete my Master in Lifestyle Medicine, and I've become a fellow of the Australian Society of Lifestyle Medicine, as well as our College of General Practitioners as well. So that's kind of led me to working here at 3D and offering lifestyle medicine appointments. So I'll talk a bit more about that at the end as well. So what we're going to be talking about this evening. So I'm going to be talking a bit about what lifestyle medicine actually is, but then really focusing in on metabolic dysfunction, metabolic syndrome and insulin resistance, and then a few practical takeaways you can all take away and might action in your own lives, or talk to family members about, talk to friends about. And then Kelsey's going to jump in and talk specifically about the exercise side of things with metabolic disease. And then we'll have some time for questions at the end. So, so to start off with lifestyle medicine, it's really a multidisciplinary field, and it looks at really the pillars of nutrition, physical activity, sleep, social connection, stress management and substances, and all of their impact on, like I said, prevention and management of disease. And I think some of the statistics, they say 80% of chronic diseases and premature death could be prevented by not smoking, being physically active and adhering to a healthy dietary pattern, which I think is pretty powerful when you think about that. So they're kind of the pillars that I'll talk about to do with the metabolic health and general wellbeing this evening. Like I said, one of my favourite things to talk about with lifestyle med is metabolic health, and particularly metabolic dysfunction. And I think when you look at the Australian statistics, this is pretty powerful. So they say 1 in 3 Australians are living with some sort of metabolic dysfunction at the moment. And in the last 20 or so years, the number of people with diabetes has increased by 2.8-fold. And now over 1.3 million Australians are impacted by diabetes. And that's really just the diabetes that we know about. I think a lot of it is probably undiagnosed in the community as well. And really the underlying metabolic dysfunction is often, it's a precursor to diabetes, and often people are living with that for a decade before they actually get a diabetes diagnosis. 5.1% of Australians have diabetes, 16% have pre-diabetes. And we know metabolic disease and insulin resistance, it's not just about the diabetes, but it can lead to cardiovascular disease, the non-alcoholic fatty liver disease, things like polycystic ovarian syndrome are also linked in. Having metabolic dysfunction increases your risk of cancers and things like that as well. So this little person picture kind of talks about all the impact that metabolic dysfunction can have on the body. So I mentioned about the heart, so increase the risk of high blood pressure, atherosclerosis with plaque buildup around the heart, increases the risk of heart attacks, increasing the risk of diabetes, increasing the risk of inflammation, so kind of just like general inflammatory body molecules in your body. That can lead to fatigue, that can lead to chronic pain, that can have lots of impact there. We spoke about the metabolic associated fatty liver disease. So with fat buildup in your liver, I think they're saying in the next few decades, actually, this is going to be the leading cause of needing a liver transplant for people. So that's overtaking a lot of the hepatitis and alcoholic liver disease that used to be the case. Can impact on the kidneys and kidney function. And like I said, having underlying metabolic dysfunction also increases the risk of cancers. So things like breast cancer, uterine cancer, colon cancer, all have an increased risk when there's metabolic dysfunction there. Also impacts on brain function. There's people sometimes talking about like Alzheimer's is almost like type 3 diabetes because it is linked in with some metabolic dysfunction as well. So to take a step back, often I draw this on a whiteboard. I got ChatGPT to draw this for me, but I think it works. I like to give people a little bit of a physiology lesson about actually what's happening when there's some metabolic dysfunction. So I'll talk about what happens normally. So normally, which is up the top, normally your pancreas produces insulin, which is a hormone. The insulin acts on your cells and tells your cells to kind of take the glucose in from your bloodstream to keep your blood sugar levels at a stable level. So that's what normally happens. But we know with metabolic dysfunction, that leads to what we call insulin resistance, which means that the cells don't really listen to the insulin as well as they should. So the pancreas needs to produce more and more and more insulin to keep those blood glucose levels stable. So often actually, by the time that someone's diagnosed with diabetes, often they've had underlying insulin resistance for a decade or more before they actually get that diabetes diagnosis. So actually, if we're identifying the underlying metabolic dysfunction, we're identifying the insulin resistance, it's much easier to manage that there rather than waiting for a diagnosis of diabetes a decade down the track. And we know that like actually having high insulin levels and insulin resistance has effects and it impacts on your body. So the hormone insulin tells your body to hold on to fat. So often people with insulin resistance find it really hard to lose weight because the insulin's working against them, telling them to hold on to fat. It can impact on hunger and cravings, impact on inflammation. So it leads to this kind of like underlying inflammation in your system, impact on and then all the other things that we spoke about with your blood pressure and heart disease and things like that as well. And that's before someone actually gets a diagnosis of diabetes. So then this is when we're like, okay, so how do we diagnose like underlying metabolic dysfunction? And this is when we think about, the metabolic syndrome. And I think to get a diagnosis of metabolic dysfunction or metabolic syndrome, you need at least three of these 5. And actually it's quite easy. Often when I see patients look through the bloods, it's quite easy that you get to 3 of these 5 without even realising. So having a waist circumference, so for European descent, for men, it's over 102 centimetres, and for women, it's over the 88 centimetres. So checking what over 1.7 linked in with this metabolic syndrome. Having a reduced HDL, which is often called the good cholesterol, so less than 1 or 1.3 in women, having an elevated blood pressure over 130 on 85. But I think often I know when I used to see patients and things like that, often the GP is like, oh, it's 135 on 85. We don't really need to do much. But actually, all these things are early signs of underlying metabolic dysfunction. And then elevated fasting glucose of more than 5.5. So having, more than 3 of those would mean that you have underlying metabolic dysfunction. And then we think about, okay, so what are some of the risk factors for insulin resistance and metabolic dysfunction? We know having having increased body fat and having obesity increases your risk of this happening. And then it can be a vicious cycle because, like I said, the more insulin you've got on board, the more body weight you gain as well. So it kind of just feeds in with each other as well. We know having a sedentary lifestyle, we'll talk more about the importance of muscles in metabolic disease, but having a sedentary lifestyle increases the risk. High caloric diets, poor quality diets. So often when I'm talking to people, it's not just about the calories that you're eating. I don't really care about the calories. Often it's actually what is the type of food that you're putting in your mouth is really important. We know that as you age, naturally that's going to impact on your metabolic function just to some extent. So that's something that we just have to be aware of as well. There's also a genetic susceptibility, but just because you've got a strong family history of diabetes doesn't mean that you're going to end up with diabetes. There's epigenetics at play, and what you're doing with your life really can make a really big impact as well. And then there's more and more research into the role of like fetal and childhood nutrition on long-term health as well. We know that if mothers had poor diets and gestational diabetes and things like that, that increases the risk of that happening in their kids when they're older as well. And similar insulin resistance linked in with that metabolic dysfunction. I sometimes do check some additional blood tests that aren't always done, like a fasting insulin, and look at that fasting insulin level in terms of a fasting glucose to actually see, is your body producing more insulin than what we would expect to keep those blood glucose levels under control as well. So that's a bit of a background of kind of what metabolic dysfunction is and things like that. But I think a few key takeaways: a lot of people in the community have underlying metabolic dysfunction, and that can lead to a range of different symptoms before actually you get diabetes. So I think, the stubborn weight that just isn't shifting, the energy levels, the fatigue and things like that, that all can often be linked with underlying metabolic dysfunction. And I'll talk a bit more about that now. Now we're going to be talking about what you can be doing. And I think one of the big things is optimizing diet. We know that diets that are high in carbohydrates, high in processed food, kind of feed into this process. And I'll talk a little bit, maybe I'll use this picture. So often I talk to people about actually, like, if you're having just a carb, like a meal that's mostly carbohydrates, that's broken down into sugars in your bloodstream. So you often get a blood sugar spike. When you get a blood sugar spike, your pancreas is like, oh, I need to work, I need to produce that insulin in response. Often in insulin resistance and metabolic syndrome, your pancreas is then producing more and more insulin. That then leads to quite a dip in your blood sugar level. You then get cravings, and often the food that you crave is the carb food. So if you start your day with a high carb food, often that continues throughout the day, and you just have these blood sugar spikes, blood sugar dips, and cravings throughout the day, and that can really impact on energy levels. I know often I see people kind of, particularly if they have a really high carby lunch, it's like at the 2:30, 3 o'clock, and you're just like, I just need a bit of cake now, or I just need some chocolate, and you're really reaching for those. But playing around with what you add to your meals is really important. So actually, if for breakfast, instead of just having plain cereal that's going to be broken down into sugar in your system, if you add protein, healthy fats and fibre, that actually stabilises it, and you don't get the same blood sugar level spikes there. And again, that means you don't get the same cravings later in the day, and that helps with your food choices later in the day as well. Does that all make some sense? So often I think about encouraging people, I like to say, like, no naked carbs. So don't have any carbohydrates by themselves, always pairing it with a protein or a healthy fat and things like that really helps to stabilise those blood sugar levels there. When we're thinking about overall kind of well-being and longevity and things like that, the diet that really has the most evidence in that space is the Mediterranean style diet. So high in plants. So fruit and veg, beans, lentils, legumes, those type of things, using olive oil, reducing the amount of saturated fat, particularly from red meat, using more chicken and oily fish in your diet is really important, and mostly having these like whole foods and minimal ultra processed foods in your diet. There's some evidence that if you can have 30 different plants in your diet each week, that can really support a healthy gut microbiome. So when we think about your gut microbiome, so all the bugs that live inside your intestines, those different bugs, some of them can be producing like anti-inflammatory molecules or short-chain fatty acids that help overall well-being, whereas some of them can be quite inflammatory and lead to the risk of chronic disease. And we know that the gut microbiome that are fed off plants particularly are all anti-inflammatory in nature, but really having that variety feeds all different of those bacteria. So 30 plants is the magic number. And it's nice to do a bit of a calculation of what you're doing. But that includes fruit and veg, nuts and seeds, herbs and spices are worth 1/4 point. Some mornings I get to 12 by breakfast, but I think, yeah, nuts and seeds are a great addition to everything. If you like grilling, frying, toasting, getting a bit of char grill on something, use that as a special treat, not an everyday. That they produce what we call ages. They're carcinogenic and they can increase the risk of chronic disease. Don't do that too much. The timing of intake, it's good to try and have like at least a 12-hour fasting window overnight. I think particularly with metabolic dysfunction, having 12 hours, having some time for your insulin levels to drop, your blood sugar levels to drop, burn some fat so you don't always have sugar in your system, it's useful. But also when you're thinking about like gut health, your gut needs some time to repair overnight as well. So trying to have 12 hours without food overnight is really important. When I'm talking to people about diet, I like to talk to them about what can you add to your diet. I think no one wants to be told, don't do this, don't do that. But it's actually like, what can you add? So what can you add to that carbohydrate to make it more of a meal? What protein can you add? What healthy fat, what fibre can you be doing? I find that all really useful to do. We spoke about that. Physical activity, I'm not going to go into too much detail because Kelsey's the expert, so she's going to talk about the physical activity side of things. I think, yeah, but muscles have the special power of utilising glucose without the need for insulin. So actually when you've got underlying metabolic dysfunction and insulin resistance, having strong muscles on board really helps to improve that insulin sensitivity and helps to stabilise the blood sugar levels. So yeah, you'll talk more about it. But yeah, often I encourage the resistance exercise, and particularly doing some movement after you've eaten can also be really useful. And I'm sure you all probably know that in your own lives. Your energy is always a bit better if you can do some movement after you eat. Sleep's really important. We know that if you're not sleeping properly and you're not sleeping well, that impacts on every aspect of your life. Often your food choices are poorer the next day when you don't have a good night's sleep because you're often wanting those quick fixes for that quick energy because you don't have any energy because you haven't been sleeping. Impacts on your physical activity. We know that it can impact on cognition. But like impacts on cardiovascular disease, obesity, dementia, depression, chronic pain, cancer, diabetes. Really, sleep, really important. Really, we say it's good to have between 7 and 8 hours sleep if you can. And just a few kind of tips on how to try and optimize your sleep as much as you can. So having a set bedtime and a set wake up time. Often I talk to people about actually we're all like big babies, and I think about my own kids and things like that. Babies always sleep well when they've got a set bedtime, a set wake up time. They've got that routine. They know when it's time to wind down and when it's time to go to sleep. And we almost have to treat ourselves like that as well. So having a set routine when you're going to bed, trying to keep the bed just for sleep as much as you can, because again, if the bed's somewhere where I watch a TV show, I do other things in bed as well, when you then go to switch off and fall asleep, your mind's like, this is where I watch TV. I'm not going to fall asleep now. I'm going to be wanting to do these other things. So trying to keep the bed just for sleep. Getting morning sunlight is really important to kind of set off your circadian rhythm in the morning. So trying to see the sun in the first half an hour when you wake up. Alcohol can make you feel a bit sleepier in the evenings, but actually impacts on the quality of your sleep. So even one drink can really impact on your sleep. With the timing of food. So we've got our body clock in our brain that's telling us when we're tired and when to fall asleep and things like that. But our gut also has its own circadian rhythm. So if you're eating right up until you go to bed, your gut's then awake and processing food and trying to digest that food, and your brain's trying to sleep. And there can be a mixed match of messages then, which can impact on your ability to sleep and stay asleep. We know that exercise is really important for sleep. Probably don't exercise right before bed because, again, that sends off your endorphins, can impact on your sleep quality, but exercise earlier in the day is important. We spoke about the bedtime routine and not having too much caffeine late in the evening. I feel like everyone has a different sensitivity to caffeine. Some people can have a coffee after dinner and fall asleep, and that's fine. I can't have a cup of tea after 10 a.m. and I'm awake all night. So everyone has different caffeine sensitivities. The next one is kind of stress reduction, because we know that stress can impact on your metabolic health and can also impact on your overall well-being as well. Long-term elevated stress increases the inflammation in your system, increases oxidative damage and cellular death, can impact on your cognition, can impact on your energy levels, impact on pain, impact on your gut function. So it has really long-lasting effects there. Sorry, everyone online, I feel like I'm about to cough, so I'm sorry if I turn off your speakers. And I think often in our modern lives, we live stressful lives. I was listening to an interesting podcast a few weeks ago, and they were saying often by the time some people get out of bed, they've had 5 different stressful events even before they've woken up in the morning, because they've been woken up by an alarm, which has caused them stress. They've then reached for their phone and probably checked the news or checked their emails. Again, that's stress. Probably spent a little bit too long scrolling on social media then when they had their phone in their hand. And again, it's like, oh, now I'm late for work and now I'm stressed and in a rush. And then I'm going to go and have a coffee. And again, that coffee causes your heart rate to go up, and your body doesn't really know if your heart rate's up from a coffee or up from stress, which again adds to the stress response. So I think there's all these little moments before 7:30 in the morning where you're having stress, and then that just adds to it throughout the day. So then I often think about, okay, what can we be doing to try and help to manage our stress levels? And I think sometimes we're like, okay, I'm just going to hold out for the weekend. I'm going to hold out for that holiday. That's when everything's going to be stress-free. But actually trying to build in some practices throughout the day is really important. And I think with these, everyone likes different things. Some people love meditation. Some people love mindfulness. I find breathing exercises are one thing that actually often work for everyone, because it, kicks in that parasympathetic nervous system and helps with some of that calming response. One of my favourite breathing exercises is box breathing, where you basically just breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, hold for 4 seconds. And doing that for a minute or two, it's amazing how much calmer you can feel after you do that. And often I encourage people, actually, could it be once an hour, you do a few minutes of box breathing? Sometimes if people are doing a lot of driving, every time you stop at the traffic lights, can you do some box breathing and do that? There's some evidence for chanting. If you think about the monks and their chants and things like that, actually the chanting and the vibrations that the chanting brings stimulates what we call your vagus nerve, which kind of kicks in your parasympathetic, your relaxation response, which is kind of interesting. There's progressive muscle relaxation, which some people really like, particularly in bed, can help to calm you down. And one of my other favourite things is positive psychology, which I'll talk about in a few slides as well. But I think often the stress reduction strategies, people are like, oh, I'll just deal with that later. But actually this is really important as part of a routine, and I almost see it as like bicep curls for your brain, having these little mind moments. Because we know that we all kind of have a limit for how much stress we can handle there. This is the bucket analogy. I heard a really good analogy as well about a sponge, and we're all like sponges, and like a sponge you can absorb so much, but then they'll get to a stage where you can't absorb anything else. What actually, how can you take some water out of the bucket? How can you take some water out of that sponge? So things like the stress, things that we just spoke about on the last page. And then positive psychology. I think sometimes it's really easy to kind of focus on the negatives and be caught up with those, and we don't always think about the positive things. And I know one of the things, like I've got 2 little kids and life gets busy at times. One of the things I've been trying to really do is like savouring the good times, and actually when things are really good, taking a step back, being like, oh, I'm really happy at the moment. Like this is really fun. We're having a really good time. So different positive psychology techniques are things like savouring, things like gratitude, kindness, empathy. What are your strengths? Where do you get meaning in your life is all really important. Social connection. I found that this statistic really interesting. So 1 in 4 Australians were experiencing some degree of social exclusion in 2017, and 40% of those in middle-aged and older are lonely. So that's a lot of people in the community that are lonely, and we know that when you're not socially connected, that impacts on behavioural, psychological and physiological function. So your immune, cardiovascular, metabolic. When you're lonely, it impacts on your metabolic health and your nervous system. So when you're socially isolated, there's a 30% increased risk of having coronary heart disease and heart attacks, and a 32% increased risk of a stroke. So I think, staying socially connected is really important. That's what I love about some of the programs that they run here at 3D. Like actually, it's not just about doing the physical activity, it's the socialisation that comes with that as well is so great. I think sometimes it can be nerve-wracking becoming socially connected again, and like actually what should I be doing and things like that. Often I talk to people about, what did you used to enjoy doing? What are your interests? What have you stopped doing over the last decade or so? And actually, can you try and get back into some of those things that you used to enjoy? Often that's a good place to start. Group programs are great. Trying to address the barriers, what's stopping you from doing it. Even things like once a week, I'm going to call an old friend that I haven't spoken to for a while, and building some of that social connection is really important. And I think when I'm thinking about metabolic health and creating change, trying to work out actually, how do I create these changes? How do I think about changing my diet? How do I think about implementing the physical activity? How do I change my sleep and things like that? Often it starts with thinking about motivation. Okay, so what's the motivation to change now? I think sometimes you see, okay, there's been someone in the media that's had a heart attack and things like that, and that's been the big call for everyone to go out and get their heart checked, and that motivates people. It could be a family member that had terrible diabetes, so that's the motivating factor to not want that. But what's the motivation and why now? I think setting yourself small, achievable goals. We know that, like, I've just gone through a massive list of so many different things we could be doing. It's unrealistic to do everything. And that's really overwhelming to do everything. But it's about actually, what's a small thing that you can be doing now? Make it small, make it achievable. Once you're doing that, you can build on that going forward. I often talk to people about when you're setting a goal, ask yourself on a scale of 1 to 10, how likely is it that you're actually going to complete it? If it's anything less than a 7 or an 8, scrap that and rethink it, because you're not going to do it. And then that doesn't help with your motivation. If you're like, oh, but I set that goal, oh, but I didn't do it, what's the point? I'm not going to do it. It's better to tell yourself, hey, I'm going to go to the gym once a week and actually do that, and then build from that, than beat yourself up for not going 3 times a week. Trying to reduce any of the barriers. I know some of the physical activity things in the morning, people are like, oh, I go to bed and I've got really great intentions, but then I get up and I just can't be bothered. But things like, I'm going to put my exercise clothes out next to the bed. So the first thing I'm doing is put those clothes on. And once you've got your clothes on, you're halfway there. That reduces one of the barriers that's there. Actually, what food are you keeping in your house? What food are you bringing home? I think if there's not the temptations in the house, that's different. Is there any food that you can be prepping to make those better choices? If you know, actually, every time I go to the gym, I come home, I'm starving and I'm reaching for something that's really processed and carby, what can I have pre-prepared that's sitting at home that I can go to instead? Like I said, what can you add, not taking away, particularly, dietary-wise. I don't like telling you necessarily not to do things. And then reviewing and changing. And I think different stages of life all has different aspects there. Very good. That's the end of my little bit. And I might throw to you. Is that okay?
Yep.
And then we'll do questions. I'll just take off my...
Cool. So I'm just going to briefly talk about exercise and metabolic health. I think Beth did an absolutely amazing job of explaining everything, but a really easy thing to change. And as we know, it's 3D physio, exercise is key. So we'll quickly go through the research first. So research has found that exercise is a key preventer and treater of metabolic disease, with some studies showing it's actually better than any pharmacological intervention, which is really nice. And then research also shows that exercise can significantly improve insulin sensitivity, glycemic control, cholesterol levels, body composition, hormonal regulation, and cardiovascular health. This is all kind of great, but I think what's really important to me when I'm showing people how it helps is how they'll actually feel and what that looks like. So we're going to start with the acute effects of exercise on metabolic health. So you've done your workout, you've gone for a walk, you've done something that's got your heart rate up or your muscles feeling a little bit fatigued. So immediately you're going to see an increase in glucose uptake, leading to rapid reduction in blood glucose levels during exercise. So what that will look like for you is you'll feel like you won't have that crash mid or post exercise, not feeling really fatigued or really low in energy. The really important one that Dr. Beth talked about is insulin sensitivity. So a single exercise session can increase insulin sensitivity by 45 to 78% for up to 24 hours post-exercise. That's a really important one. What that will feel like for you in the moment is you'll feel for that 24 hours post-exercise that you won't have those highs and lows that Dr. Beth talked about with the food consumption as well. So you actually feel more stable. You're not going to feel really energized and then hit 3 p.m. and then, crash and sit on the couch and not be able to do anything. And you will also have less sugar cravings, which is really big plus as well when you're trying to keep that diet good. Increased energy expenditure. You might not feel this in the moment, but over time you will feel a lot better in your body, and it will also assist with any kind of weight loss and body weight management as well. Lower triglyceride levels. Over time you'll feel less sluggish, a little bit more energized. Your anti-inflammatory effects. So this increases cytokine production, which is a really important thing for your body to process inflammation and get rid of it. So you're going to feel less stiff in your joints. You're going to feel like you're able to move more and feel overall better, less inflammation. You're going to feel more energized and better and be more excited to move. And then improved blood flow. So glucose and insulin delivery to the skeletal muscles, which is really important for recovery. So you're not going to feel really sore the next day or go for a walk and then all of a sudden you can't do what you plan to do the next day. Long-term effects are quite similar, but I think it's important when we're looking at particularly at body composition. So like I said, we have our persistent improvements in insulin sensitivity. So decreasing those crashes, feeling energized, even though you might be doing more than you used to do. And then improved body composition. So you're going to be able to do the things you want to do and do them well and be able to wake up the next day and still feel like you can continue on with your day-to-day tasks. It's really important. So, exercising, but also keeping on living your life and doing the things you love. So decrease visceral fat, increase lean muscle mass. So you're going to feel stronger and you're going to be able to do everyday tasks so much easier. And then overall decreased body fat percentage, which is what's really important for metabolic health in general. You're going to have your improved lipid profiles, which is really important. Reduced chronic low-grade inflammation, like I mentioned, so feeling a lot better in your joints. Improved metabolic efficiency, so your metabolism and your body's ability to process foods and create energy. Improved cardiovascular health, and then reduced risk of developing diabetes, cardiovascular disease, and metabolic syndrome. So I think the main takeaway is using exercise to, yes, decrease metabolic syndrome, but also take control of your health and how you feel day to day. It's really important to feel like, okay, I have control over how I feel and what I can actually do. So the recommendations. So Exercise and Sport Science Australia, ESSA, which is the main kind of exercise research facility for exercise and health, they've actually recently updated their physical activity guidelines. So they've changed it to be a little bit more achievable in their wording, I think. So it is now 30 minutes or more of moderate intensity physical activity on most days. So I would count that as probably 5 days a week. Muscle strengthening activities on 2 or more days per week. Functional activities which target mobility, balance and coordination on 3 or more days per week. And then several hours of light intensity physical activity. Sounds like a lot when it's listed out like that and can be quite overwhelming, but you can break it down quite easy. So if we start with the bottom, the light intensity physical activity, we're looking at going for a walk. You're doing your shopping, you're in the garden, you're doing random things throughout the day. That's that light intensity physical activity or just moving your body. So making sure you're getting up, walking around the house, doing some cleaning, things like that. Looking at functional activities and muscle strengthening, we can kind of bring them together. So muscle strengthening, we know you're doing your body weight exercises, simple things like your sit to stands, then you can go to your bands and then, think about group exercise classes or working in the gym, and then combining that with functional activities. So whether that's, playing golf, doing something you love, playing with the grandchildren, things that really test your balance, make you move around quicker, a little bit more, and get you moving in a way that you would normally from day to day. And then your 30 minutes or more of moderate intensity. So that is making sure that you are getting a little bit puffed. What that means, it could be quite hard, but think about your walking, adding in a hill in your walking route. So going the opposite way than what you usually would. All of a sudden you're puffed and you're getting that moderate intensity exercise, or setting a goal for times. Okay, I want to achieve this 5K in this amount of time because I'm usually doing it 5 minutes slower. Really trying to walk with intent, I think, is key. And then looking at non-weight bearing if your joints aren't happy with that fast walking. So thinking about your stationary bikes is a really good one to help with getting your heart rate up, but not doing too much to the rest of your body. So it's just something to think about and try to work up to it, like Beth said, with your goals. So don't think, okay, next week I'm going to do everything. Next week I'm going to try to do 1 walk every second day, and start from there and then build the habit up is really, really important. I think that's all I've got, but we might jump into questions overall for Dr. Beth and I, if anyone has any. Is there any online, Alana? Cool. If anyone online does have questions, feel free to shoot them through in the Q&A section now, and then we can read them out and answer them accordingly. Anyone in the room have any questions?
Yes. When your weight doesn't shift, after doing so many exercise, what's the best exercise for that?
Yes, yep. So if weight isn't shifting due to exercise alone, I think it's those other factors that Dr. Beth talked about that are really important to consider. We could definitely review your exercise, and if you think I'm hitting everything that those recommendations are saying, then we would probably look deeper and look to the other side. Beth, if you want to talk about that a little bit more.
Yeah, and I think this is where we know that exercise has so many benefits, not just with weight. Actually, when you look about weight loss, I think the number off the top of my head is actually 80% comes from diet and 20% is exercise. Yeah. So actually the biggest change comes with what you're eating. The exercise supplements that, but you can't, often people say you can't outrun a bad diet because really a lot of it's coming from the food side of things as well. And I think this is where sometimes, rather than looking at a number on the scales, thinking about other measures as well. So actually thinking about how you're feeling, thinking about some of the markers that you do. Actually, I can walk faster. I can do more sit to stands. We can think about actually, even despite my weight changing, my weight not changing, my waist circumference has gone down, and that's improved your metabolic health.
So that's right. You're okay.
Some people also then like have body composition DEXA scans and things like that that can look at actually, despite the weight not changing, maybe your weight hasn't changed because you've actually put on muscle, and that's a great thing. So I don't always love looking at a number on a scale, because sometimes the weight doesn't shift, but that doesn't mean that what you're doing isn't making a good impact and you're not improving your health with that. Yeah, does that make sense?
It does.
Yeah. All good.
Any other questions?
Does drinking coffee on an empty stomach increase your cortisol levels?
I think it probably does. I would need to have a look at actually what the studies do. But again, that's putting your heart rate up, that's making you feel like you're stressed. That's going to put your cortisol levels up. Testing cortisol levels isn't something I routinely do because they fluctuate so much during the day and things like that. But really anything that's going to put a stress in your body is going to increase your cortisol level up. Yeah. The question was, does drinking coffee affect cortisol on an empty stomach? Yeah. And I think this is where it's individualized, and everyone's a bit different. Some people, can have several coffees. Some people feel quite like jittery and things like that with just one. And I think sometimes this is then playing around in your own life. Like if you feel like, oh, I've been drinking a bit more coffee and I am feeling a little bit more anxious and a bit more stressed, try cutting back and see how you feel and see if it makes a difference. And this is where you have to kind of experiment on yourself a little bit. Yeah.
I have a lot of dietary restrictions.
Yeah.
Intolerances. It affects everything.
Yeah. Yeah.
Is that exacerbating the problem, or is the problem causing the dietary issues? I know that's
Yeah, and I think with dietary intolerance, it makes it really tricky. And I should have had a caveat. I'm not meant to give like individual personalised advice, but I'll talk generally if that's okay. And I think sometimes, because there's a lot of like irritable bowel syndrome and things like that out there, and people can't tolerate some of these things in the diet. Sometimes I read a really interesting book. It's called Fiber Fueled. A gastroenterologist in the US wrote it, and he's got a whole plan to try and improve some of those, particularly the kind of FODMAP intolerances that people do in IBS. And often it's about having a slow build up of those foods, because often you can't tolerate. There's allergies and intolerance. If you've got an allergy, you're not going to be able to do it. If you've got an intolerance, often it's because you don't have that gut microbiome to deal with it. So your gut doesn't really know how to deal with it. So his approach is, like slowly building them back in and bringing them back in, because like if you were to run a marathon, you couldn't do that without any training. So it's almost like retraining your gut and bringing them back in small volumes. Does that make sense?
Yeah.
And I think this is where kind of working with a good dietitian and things like that can also be really useful. And I think particularly when you've got intolerances, working with a dietitian to work out actually, am I getting enough protein in? Am I getting enough fibre in? And things like that is also important. Yeah. Oh, good. Yeah. No, definitely. So I think when I'm thinking about, a day of eating, I often think about the number 30 and trying to have 30 grams of protein with each of your meals, which gets you up to about 90 grams in the day. It would be good if you get a little bit more, but that's a good starting point. And then 30 grams of fibre is the other really important thing during the day, because getting enough fibre is really important for your cardiovascular health, your metabolic health and general well-being as well. So when I'm thinking about, planning a meal, okay, what's going to be my protein in here? What's going to be my fibre in this meal? And often with the fibre, so the fibre you get from plants, like beans and lentils and things like that are great because they've got some protein and some fibre. They're really good to kind of build into your diet as you can. But often when I'm thinking about a meal, I'm thinking about, okay, how can I add an extra plant into that? Because any extra plant that you add into a meal is going to be extra fibre. And I know like at the moment for myself, when I'm doing things like cooking a bolognese, I'm using half meat and half lentils and then adding all the veggies on top. But suddenly those lentils are adding in more of that fibre. Similarly with a stir fry, half beet and half chickpeas, and just thinking about how you can add beans and lentils and things like that into meals to increase the fibre up. I think actually with some of these, like, it's really useful to kind of work out yourself at the moment what your general breakfast, how much protein you're having in it, how much fibre you're having in it, and throughout your day kind of what your protein and fibre intake is like. So this is where actually I find some of the online things, even like ChatGPT and things like that, can be useful, because you can type in, this is what I'm having for breakfast, how much fibre is in it, how much protein is in it, how could I add extra protein? And it will tell you like what you could be doing to add that. And I find that like a really quite simple tool that people can be doing initially. And then when you get to see a dietitian, actually you've got some of that background knowledge and they can really fine tune and make it specific for you. But yeah, often I think about when you're planning a meal, what's your protein, what's your fibre, and going from there. But everyone has their own dietary choices and things like that. Yeah. Yeah.
Any other questions?
Depends on the type of bread, depends on the person, depends what you're pairing it with. And I think probably, yeah, like it's interesting, like if you're, there's a whole range, like if you're having honey or jam on a bit of white bread for breakfast, that's just carbs, versus I'm having a whole grain piece of sourdough with avocado and an egg. You can have bread like that. Yeah. Yeah. And I think actually some people find with like the gluten sensitivities and things like that, often they cope a lot better with things like sourdough versus others. And I've also heard stories of people like, actually in Australia I can't tolerate gluten. You go overseas to somewhere like Italy where there's less processing and things like that, and suddenly you can tolerate gluten again. Yeah. Yeah. Any other questions?
Getting the slides.
Yes.
Yeah.
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 We also have Prue has organised AI to transcribe this, so we can also organise like actual notes of everything that was said in combination with the slides as well for everyone. We're also planning on doing a lot more education sessions in the future. So if anyone has any particular topics or specific interests that they would like us to either get a professional or get one of the physios or EPs here to talk about, let us know. We have a feedback box here as well. So if there's anything we could have done better today, feel free to let one of us know or write it down or send an email, and then along with any future topics as well, because we'll do our best to find the professional or do the research or have someone here to educate you guys. So just a little bit, I thought I'd put that in there at the end, but
yeah.
Anything else?
Yeah. Yeah. And I might just add like, or this links to my website. I did make a blog post, but then I couldn't work out how to publish it on my website. Watch this space. My husband's helping me with it. So you'll be able to read more about metabolic disease once we work out how to publish it. But yeah, so at the moment, I'm working on Mondays and alternate Wednesdays down at Sternberg Street, and offering lifestyle medicine consults, so kind of hour-long consults to go through a lot of this lifestyle stuff, see where you're at the moment. And the plan is to complement your regular GP. When I'm doing hour-long consults in a day and a half a week, I can't be your regular GP, but I feel like there's a lot that I can offer to kind of complement the care that the GP is providing, that they don't have time to do in a standard 15-minute consult. Yeah.
Cool. Really good. Thank
Cool.
you.
Oh, good.
Thank you.
For those who are interested also, our next chat will be with Jed, one of the physios here, on lower back pain. So keep tuned and we will let you know when that will be.
For
Beautiful.
those people who come here and they stop, but they still want information, how do they go about getting the information?
Information on
Like educators coming in to give
yes,
topic.
yeah. So we
talk about a topic.
yes, so we should send out email communications as well. So you should get via email some information about our next educators. But yes, they are for people, current clients, previous clients, people off the street, whoever wants to come and listen to us talk. Yeah, yeah. So but yeah, if we also post on our social media as well. So on our Instagram as well.